Here at Queen's Park, the NDP's new leader is doing her best to keep the Ford government under fire. She brought up the controversial stag and doe the Premier had for his daughter, which some developers attended at $150 a ticket. It made for some interesting fireworks again in the legislature.
Let's review the timeline, shall we? The stag and doe was in August. The wedding in September. Just 2 months later, this government broke its promise to the people of Ontario and started carving up the Greenbelt. Now we find out that some of the very people who attended the Premier's family festivities suddenly had their land value skyrocket due to this government's decisions. Curious.
The people of the province of Ontario made a very important decision in June, Mr. Speaker, and what they decided to do was reduce the opposition and to elect more progressive Conservatives to this chamber to get their priorities done, Mr. Speaker. They had enough of the negativity that was coming from the opposition. Now, Mr. Speaker, this is a party who couldn't even muster enough energy up to have a leadership race. They had to appoint their leader.
Now, it's true, Ford was elected in June with a healthy majority, but he didn't campaign on opening up the Greenbelt for development. While the Integrity Commissioner has cleared Premier Ford of any wrongdoing, public perception is critical. Even if he hasn't technically breached rules, if voters don't approve, it could have a negative impact on him in the long run. Expanding access to private health care is the Ford government's first order of business here at Queen's Park. It tabled new legislation yesterday that will increase procedures like cataract surgery and hip or knee replacements in private clinics. Now, of course, any move to change health care gets heated. The Premier defended the move today in the legislature.
Just think, you have an elderly mother, an elderly father that's been in pain for a year because they can't get a hip replacement. They're going to be able to get that hip replacement and change their lives every single day.
The Ford government says when passed, the legislation will shorten wait lists. Critics, though, say the move will poach healthcare workers away from hospitals, which are already understaffed. They also warn there won't be enough safeguards to protect patients from upselling procedures.
What we are against is profiteering and creating a runway for corporate interests to come in and upsell patients, upcharge patients, and leave our healthcare system with inferior patient care, which has consistently been shown to be the case in almost every example of for-profit care, healthcare in Ontario and, frankly, around the world.
Now, the federal health minister's office commented on this new bill, saying, quote, "We're aware of the Government of Ontario legislation introduced yesterday and will be reviewing it closely to ensure it respects the Canada Health Act." Last month, Prime Minister Justin Trudeau referred to Doug Ford's plan to offer more privatized health care as innovation.